A very warm welcome to all of you for joining in today's public webinar, organized in conjunction with World Sleep Day. I'm Eric Lim. Dr. Julian and I founded Somnus Sleep Wellness on the belief that satisfying sleep is a vital pillar of health. Our mission is to provide education, support, and solutions to individuals, helping you to live better by sleeping well. Sleep is often undervalued and over-sacrificed in our fast-paced society. I'm so glad that you have taken the time today to know more about your sleep health inside out, and we'll have a live Q&A after all the speakers have presented. So you may post your questions in the chat box inside Zoom, and you can state the speaker whom you'd like to answer. You can also raise your hand using the reaction button in the Q&A segment. So if let's say you'd like to ask the question live, you can put out your hand and you can unmute yourself, turn on your camera and ask your question later. All right, let's get started by first allowing yourself to sit comfortably. So I'm going to start off by inviting you to engage in this opening mindfulness practice to ground ourselves in this present moment. So if you allow me to, let's take this moment to allow your eyes to gently close. And let's begin by taking in 3 beautiful deep breaths. And perhaps at the end of your third breath, allowing yourself to just notice this, how the body feels right now. Just noticing the sensations in your feet against the ground. Feeling to the contact of the toes. Just feeling to this whole body itself. Your hands resting on your lap. Noticing the entire back supporting you as you sit upright. All the way up into the top of the head. And noticing as well how you feel right now in terms of any emotions or feelings. Whether you're excited about what's coming up, in terms of what the speakers are going to share. Noticing what's on your mind right now. It's becoming aware what's present. Good. And now I'd like to invite you to just narrow your focus onto the breath itself. So see if you're able to notice where in your body you're able to notice the sensations of the breath coming into the body and out. And for the next 1 minute, really allowing yourself to welcome this breath as it comes along and leaves. And as you're noticing this breath, perhaps you might be aware that sometimes the mind does wander off to maybe a thought, maybe a sound outside. And that's okay. It's important that we are noticing what's here. Good. And now just very gradually letting go of the focus on the breath and expanding this awareness to the entire body. Just feeling to the whole body rested here this Sunday afternoon. Perhaps you're just at your lunch, just becoming aware of the whole body once again, including our facial expression, and setting an intention to be present for the rest of this webinar. So as you close off this practice, taking in 3 more beautiful deep breaths. Beautiful. Great. So when you're ready, you can just allow your eyes to gently open if they're closed. Just taking the next few moments to notice how you feel right now after the practice that we did together. Perhaps a little bit more refreshed. Yeah. So I'm going to introduce our very first speaker, and he is none other than Dr. Wong Sheau. You'll be sharing with us, how we can begin to unravel the mysteries of sleep. So why do we need to sleep? What's normal and what's abnormal sleep patterns? So Dr. Wong Sheau is a senior consultant psychiatrist and aviation medicine physician. He's currently the director of SH Wong Sleep and Psychological Wellness Clinic. Has been practicing in the public service over the past 26 years. He holds a special interest in the practice of sleep medicine, helping patients who suffer from sleep disorders such as insomnia, as well as helping the healthy to manage their sleep and fatigue issues. Dr. Wong, please.
Hi, thanks, Eric, for the kind introduction, and thanks to Somnus for inviting me to share with you one of my topics that I'm passionate about. Yeah, so yeah, it's kind of a bit challenging to have to speak just after lunch and everyone trying to stay awake, but that's normal. Okay, so let me begin. My job here today is quite simple, is to share with everyone about what is considered normal sleep and why is it important, and then just a little bit about what happens when things go wrong. So everyone probably would have encountered episodes of insomnia at least once in your life, probably a lot more than that. And in the past we talked about finding ways to get around insomnia, but counting sheep is not exactly the best way. You can be quite uncreative and only have a single sheep to count, or you are the anxious type of person, getting more anxious when you lose count, right? And then you run into further problems. Okay, so let me jump right in, talking about normal sleep. And when we talk about normal sleep, usually we look at these three things, a bit about the quantity, the quality, as well as the timing in which your sleep period occurs. So first about quantity. Babies, when we are first born, right, in the first year, right, we sleep almost all the time throughout the day. And then, getting up at night, feeding round the clock, right? But as we get older, then it's quite normal that our sleep start to get shorter and shorter. And usually by about early teens, right, it starts to get into a duration of similar to what an adult would get, right? And when we say quantity, right, you would read about it in various media, right? Typically, we say that normal sleep should last between 6 to 9 hours. Now, actually, that's what most of us would get on average. But, human beings are quite unique. There are people who are outliers. Some actually may require more sleep than 9. Some actually get by and do well with less than 6 hours of sleep. So if you follow the bell curve, right, the norms, right, a large majority would fall between 6 to 9 hours as a normal quantity of sleep. Right. So as what we see on the chart here, as we grow older, sleep tends to get less, not just in quantity, but also in terms of the composition. So in sleep, we know that there are composed of light sleep, deep sleep, as well as REM sleep, or otherwise known as dream sleep. Now, as we get older, somewhere from 45, 50 years onwards, in the older elderly adults, if you notice your grandma, your grandpa will start to complain about, not sleeping enough or getting very light sleep, or sometimes they get very fragmented or broken sleep. And that's quite common. And that's partly to do with the reduction in the secretion of melatonin by our brain, which helps to consolidate the sleep. Now, what happens when we don't sleep enough? So when we don't sleep enough, there's actually very widespread impact on the body as well as the brain. So in the brain, it can affect your cognitive function. You get poor memory. You have problem retaining new information, and you can make impulsive judgments. And in terms of mood, you are at higher risk of irritability, anxiety, as well as low moods. And especially in the young children, when a child is not getting sleep, they actually can present with symptoms quite similar to ADHD or attention deficit hyperactive disorder. And as for the body, right, when you don't get enough sleep, and if that's on a long-term basis, that can actually add to a chronic stress on the physical body, which indirectly or directly affects your immunity, your metabolic functions. You're at higher risk of obesity, diabetes, as well as risk of cardiovascular diseases, right? One of the common things in the Asian population, if you recall, when you were younger, your grandma or aunties would always say that, oh, you are still a child, you should sleep more, sleep early, try not to sleep late, because otherwise you cannot grow tall. And that has actually some truth to it, because actually in the early part of your sleep period is where growth hormones are released. So there is some truth that, if you don't sleep early, you might end up with stunted growth. But of course, that's postulates. Okay, a bit about quality. When we talk about sleep quality, we are actually looking at the various stages of sleep and what's the normal amount of each stage of sleep that we expect to see. So on the right side, this chart shows what happens in a typical night of sleep. So in a single night, right, you will get 4 to 5 cycles of sleep. And each cycle consists of transition of sleep stage between awake to the stage 1 sleep, where you are semi-awake, flipping in and out of consciousness, right? Stage 2 sleep is what we term as light sleep. Stage 3, deep sleep, and REM, dream sleep. Now, each cycle typically lasts between 60 to 90 minutes. And if you add it up, right, 4 to 5 cycles, that gives you roughly your 6 to 9 hours of sleep. Right. So in terms of composition, many people complain that, oh, I'm not sleeping very well. My sleep seems to be very light. I'm not getting enough deep sleep. But interestingly, what is considered normal is that 50%, roughly 50% of the night actually consists of stage 2 sleep, which is considered light sleep. For stage 3 sleep, the deeper sleep, the norm would be somewhere between 20 to 25%. And for dream sleep, somewhere between 20 to 25%. And that's what would be considered a normal sleep architecture. And in different kind of sleep problems, you might get interference in terms of the composition of these various stages of sleep. And with age, very often you get elderly patients complaining about, oh, my sleep is getting too broken. I keep waking up at night. I need to visit the loo, and so on. But that's also partly, due to a normal change that comes with age. So if you notice here, as we do age, the amount of REM and deep sleep tends to get less, right? You see? Tends to get less as we age. Similarly with dream sleep. And there tends to be a lot more awakening periods throughout the night. Yeah. So which explains why the elderly have such experiences, and they often catch up with sleep during the daytime with short naps or frequent naps. Just a quick look at what we expect in a typical day and what is the function of sleep. So in terms of timing of the sleep, right, typically We say that it should occur somewhere in the mid evening to morning. And during this period, right, the front half of the sleep period, right, where most of the deep sleep occurs, that is where the body undergoes physical repair. And then in the second half of the night, where the REM or dream sleep occurs more, right, and that's where the mind or the brain start to do is physical recovery. Right. I in my other talks that I give, I usually use the analogy of dreams REM sleep as something as what an old style computer used to do, right? So in the older days, right, our computer runs on spinning hard disk, and you notice that over time with usage, right, the hard disk or the computer starts to run slower and slower, and very often would hang. And then we need to perform something like or what we call disk defragmentation, right, in which the hard disk, right, reorganizes the data, chucking out all the unwanted data. And similarly in our brain, right, during sleep, during REM sleep, in fact, that is where the brain start to reorganize the information that has been captured during the day. So important memories that needs to be retained gets parked into the relevant part of the brain. Things like emotional memory, content memory, procedure memory, and so on. Right, and then all the unwanted information gets chucked away during this period. So about timing. So how do we know when we should sleep, should not sleep? What is it controlled by? So there's this thing known as the body clock, which sits in the deep part of the brain, in the hypothalamus. That's called the suprachiasmatic nucleus, SCN. And this is basically the central clock. For info, in fact, all the cells in our body, the organs, each have their own clock, right? So can you imagine if all these organs runs at different timing, then we will be in trouble because all the various functions cannot coordinate with each other. So hence we rely on the central body clock that sits here to synchronize every part of the body so that they work in symphony, right? And one of the mechanisms is through the release of melatonin from the pineal gland. And this occurs typically in the early evening when the sun sets, right? So when the sun sets, it no longer inhibits the SCN, which will then send a signal to the pineal gland to start releasing melatonin. And this goes on to the rest of the body to pass on the message to the rest of the organs and cells, right? And how does the brain actually help us sleep or get us awake? So actually it depends on a balance between a sleep signal and an alerting signal, right? So which one is stronger, you get the end result. So if the alerting signal is stronger, you tend to stay awake, you can't get to sleep. When the sleep signal is stronger, then there's a propensity to fall asleep. So in terms of insomnia, right, very often you'll find that people with insomnia, they have a super active alerting signal, which needs to be reduced. So in terms of treatment, you may have to undergo a relaxation therapy, sometimes sleep psychotherapy, to try and help you to relax, to reduce the alerting signal. Or if that's not good enough, you might have to see a doctor, and typically that would be a psychiatrist who are trained to treat chronic insomnia. And we make use of medications, right, to either increase the sleep signal or to reduce the alerting signal from the brain. So this picture actually illustrates the various deep brain centers that works in synchrony, coordinate with each other to create this balance. And these signals are then sent out to the rest of the brain, either to shut it down, get the brain to fall asleep, or to wake it up. And why psychiatrists? So if you notice here in the various deep brain centers, there are neurotransmitter systems. So things such as GABA, histamine. If you have taken a cold or flu medicine, you notice that it makes you very drowsy, and that acts on the histamine centers. And you have heard of serotonin, the happy chemical or mood chemical. So serotonin also is part of the system. And very often, psychiatrists also make use of major tranquilizers, or otherwise known as antipsychotics, which works on the dopamine centers, which then reduces the alerting system. So we make use of all these medicines to help change that sleep and wake signal balance. And in terms of timing of sleep, so other than normal sleep period, or normal is in terms of what is culturally relevant. So if you are in Singapore, you know that Singapore is a sleep-deprived society. We tend to sleep quite late, past midnight sometimes, and then wake up, before attending to school or to work. Now, in the elderly, this changes. In the elderly, more often than not, they tend to have what we call advanced sleep phase syndrome. And in this case, they tend to go to bed earlier, and then they end up waking in the middle of the night, right, 3, 4 a.m., and have trouble getting back to sleep. And commonly in the teenagers, adolescents, young working adults, they tend to get delayed sleep phase, right, in which they get to sleep much later because they are preoccupied with their activities till late into the night, and then end up waking late in the morning or sometimes near noon. And this usually, if you know, commonly happens during school holidays, where the discipline for sleep starts to loosen up a bit. And then, of course, there are other less common types of sleep timing issues. So just a little bit sharing about power napping. So sometimes in the day, when things get too busy and you feel quite drained, it's helpful to catch a power nap to, in a way, temporarily recharge yourself. But it's important to note that in a power nap, you try to keep it to less than 30 minutes. Why so? Because by about 30, 45 minutes onwards, your sleep tends to hit the deeper part of the sleep. And if you should wake up in the deeper part of the sleep, you get into what is known as sleep inertia, right? Where you wake up feeling confused or feeling more tired than before you went to the nap, right? So hence, try and keep power naps to 30 minutes or less. So now I jump on to a topic on insomnia. What's abnormal sleep? So insomnia, what is a definition of insomnia? Essentially, there are 3 types: difficulty falling asleep, difficulty staying asleep, or waking up too early, or feeling still tired or not fresh following a night of sleep. So these are the typical 3 patterns, or there could be a mixture of those. Second condition is that this problem with sleep happens, in fact, this is present despite having adequate opportunity to sleep, rather than, by habits, you choose not to sleep and doing something else. And lastly, this sleep difficulty must be associated with daytime symptoms or distress, right? So what are the factors for insomnia? So insomnia actually, if you look at it as a symptom, right? If I throw the medical textbook at you, almost all conditions would have insomnia as one of the symptoms. But and things that trigger insomnia, maintain insomnia, is multifactorial. So usually there will be more than one reason why someone would have problem getting to sleep. So we look at the various factors in broadly. So we have the sleep-wake cycle, things that affect your circadian clock, right? So things like jet lag, having shift work, and having bad habits and irregular routines. This can lead to short-term insomnia. And then, of course, commonly stress, bereavement, too much worries about a bad situation in your life at the moment, or the environment can also affect how you view sleep. And lastly, personality. People who are more anxious, overthinkers, they are too hyped up about things that have happened in the day, tends to spend a lot of time thinking about it at bedtime, and that can affect sleep. And the most common reason for chronic insomnia are psychiatric illnesses. And hence, if someone with chronic insomnia usually ends up seeing a psychiatrist, getting referred to a psychiatrist, so that we can screen for these conditions. Then there are this group where, you know, medications, drugs can start interfering with the sleep. So there are many chronic illnesses where the treatment itself can lead to insomnia. So things like asthma, as in asthma, for example, the inhalers that we use, the steroids that we use can cause increase in arousal and therefore lead to difficulty falling asleep. And then, of course, you know, sometimes off-the-shelf medicine, things you order online, particularly those that you use for dieting, weight loss products. Very commonly, this includes stimulants in one of the components, which can cause insomnia. And of course, the common self-medication when someone has a problem falling asleep is using alcohol. And while alcohol is a depressant, it helps you fall asleep easy, but the problem is your sleep quality ends up getting messed up. Typically, you get a lot of awakenings in the middle of the night, right? And then, of course, lastly, physical illnesses. Physical illnesses can lead to discomfort, pain, and sometimes combined with the medication used to treat them, can also trigger a lot of problem with sleep. Now, all these are potential causes for short-term insomnia. And if they are not addressed quickly, what will happen is that we start to get distressed over insomnia. And depending what's your personality like, how you view the importance of sleep or how distressed you are, you may end up actually perpetuating sleep difficulty that could have been a short-term problem. Right? So someone who is very anxious start to feel anxious about sleep and then commits one of the cardinal sins in insomnia treatment, which is clock watching. So the more you chase after the time, the more anxious you get and the harder you get back to sleep. Right? So all in all, short-term insomnia, if not done well, you create bad habits, you develop anxiety about it, you run the risk of getting into long-term insomnia. And then lastly, this group of disorder we call primary sleep disorders. So commonly we have obstructive sleep apnea. In fact, this is quite common, quite prevalent in Singapore. They estimate about 3 in 10 people would suffer from at least a moderate severity OSA. And then other less commonly known are restless leg syndrome and periodic limb movement disorder, which also can lead to sleep difficulties, often presenting as excessive daytime sleepiness. So all in all, if you do get insomnia, often they are short in terms of duration. If you deal with it well, you would get out of it. But if you start developing bad habits, anxiety, then you run into problems. So it's important to seek help early if you find that you have difficulty dealing with it. Yeah. So I've come to the end, and we'll see you again at the Q&A session. Thanks.
Thank you, Dr. Wong, for sharing with us your insights on the different aspects of sleep, as well as some of the sleep disorders, right? They are more common. So for now, I'm going to introduce our next speaker. Our next speaker is none other than Dr. Elaine Ng. She will be sharing with us on the lesser-known relationship between sleep and dentistry. So what do our teeth got to do with our sleep? So Dr. Elaine Ng is a dental surgeon at Smilefocus, trained in the field of sleep medicine and dental sleep medicine. She works closely with ENT specialists and sleep physicians in screening and treating patients with sleep breathing disorders. She has also worked with sleep psychologists, speech pathologists, and airway focus orthodontists for complete management of patients with sleep, breathing, and functional swallowing issues. Dr. Ng, over to you, please.
Thank you once again to Somnus Wellness for inviting me to speak. Right, so I will be speaking about another form of sleep disorder, specifically sleep breathing disorder called obstructive sleep apnea. And this is one of the many areas where medicine and dentistry actually converge. So let's get to it. So I want to just familiarize yourself with my part of the neighborhood, which is the oral cavity. This is the mouth. So I want you to notice what are the neighbors to the mouth. We have the nose that is above, and it's separated from the mouth with this bone called the hard palate. And then to the back of the throat, you can actually see the pharyngeal air space. So these are in close relation to the mouth. And I just want you to remember this relationship of the nose to the mouth as we go through the slides. So we are aware that the development of the palate affects the nasal airway space, okay? And any obstruction, that means blockage in the nose or the mouth or the throat, can actually block your airway. And this is where the air comes in through your nose and your mouth, and it comes down here to your windpipe, okay? So common structures that can actually block our breathing will be the tongue, the soft palate, and also the uvula, which is that dangling thing at the back of the throat. Also tonsils and adenoids. So you can see the tonsils and adenoids are actually located much further back, and they have the potential to grow quite large and possibly block off the airway space completely. So what exactly is obstructive sleep apnea? It's a sleep breathing disorder, okay? So a person who frequently stops breathing during the night while they're asleep will have obstructive sleep apnea, and it's known as OSA for short. It's caused by obstruction of the upper airways. As I showed you in the previous slide, all the different possible causes of obstruction, and also with the inadequate action of the airway muscles to help us when we need it the most. Okay, so you must be wondering, how does somebody get OSA? How does it develop? Well, it's very closely associated with obesity, okay? And in certain drugs, medications, and substance use, so heavy smokers, heavy drinkers are definitely at higher risk. Patients who use prescription medication like opioid painkillers and sedatives, if they are misused or they are used by individuals who are more at risk of developing OSA. People with existing medical conditions like chronic heart failure, end-stage renal disease, people with lung function disorders and asthma are definitely at higher risk. Now that we have a global aging population, it's important to note that older age is also a risk factor. So those who are above the age of 65, and in women, postmenopausal women tend to have a higher risk as well. So I want to focus more on the last category, which is craniofacial abnormalities. So what it refers to is abnormalities that develop in the head and the face region. So more specifically, we're talking about the face and the mouth. Okay, so these can arise from genetic syndromes, and they also may be developmental in normal children. So I just want to highlight that of all these risk factors, our Asian population tends to have more craniofacial abnormalities as a risk factor. And whereas obesity tends to be an issue in Western countries like the United States, that is why it's increasing in prevalence together with the rate of obesity. Okay, so let's look a little bit more at craniofacial abnormalities. So how does it start? It can happen in children who are otherwise normal and healthy. So we all know children have blocked noses and running noses very easily, and that's not anything to really worry about. But when does it become a problem? It's when that becomes chronic. And we're talking about years and years of blocked nose or running nose. And whether it's due to adenoids and tonsils or chronic allergies, it leads to the development of obligate mouth breathing. And what that is when the person is breathing through the mouth full time and not breathing through the nose at all. And we know this is bad because obligate mouth breathing will lead to an open mouth posture. So you will see the child have this kind of appearance, okay, with an open mouth, constantly open mouth, breathing in the day and also at night, sleeping with an open mouth. So the position of the tongue greatly affects the development of the face and the jaw. Okay, so you can see in this image here, that's the typical open mouth posture of a child who has OSA or breathing difficulties. So what happens when you have these facial or jaw abnormalities? What does it look like? So it's actually when the lower jaw development is affected, underdevelopment of the lower jaw, and that's called retrognathia. It's also accompanied by constricted upper jaw development, and that is called maxillary hypoplasia. And these two are very highly associated with OSA risk. So the reason why dentistry is involved is because dentists and orthodontists are often the first people to encounter these growth issues. When parents bring their children into the clinic, the main complaint is usually crowding of the upper teeth, increased overjet. That's when the upper teeth are protruding far over the lower teeth. They have a high vaulted palate, meaning the palate deforms in terms of its shape and it bulges into the nasal space. And it results in very narrow V-shaped jaws, which results in a very long and narrow face. Okay, so all these dental complications can arise from underdeveloped lower jaw and upper jaw. So what does it look like? This is what we see in the clinic quite commonly. The patient will present with a very deficient lower jaw, and because of that discrepancy, you'll see a marked overjet of the teeth. Often, people will say, oh, the child is so cute, they have Bugs Bunny teeth, but this is not cute if you bring it into adulthood, okay? And if you see the constriction of the upper jaw or maxilla, this is where you can see very clearly the V-shaped arch with the crowding and an overjet. And if you can remember back to the first slide when I asked you to remember the relationship of the nasal cavity with the oral cavity, you can see the high vaulted palate here is actually impinging. It's growing into the nasal space. So this is detrimental because it's already impinging in an area that is already obstructed. So it's worsening that obstruction in the nose, which perpetuates the mouth breathing. Okay, so this is the same thing. You see V-shaped arches with high vaulted palates with very narrow jaws, and it results in a very narrow and elongated face. So if you can catch this early in childhood, orthodontists are able to use functional appliances to correct this. This can be cured, okay? So you can go from a V-shaped arch into a very nice normal U-shaped arch, which is much more harmonious, and the palate is now in a normal shape. Functional appliances can be used in children and can be successfully completed within as fast as less than 1 year in some cases. And you can see you can achieve very nice skeletal profile in the after picture, as well as soft tissue profile. You see this child was not able to close their lips. They have incompetent lips with a marked overjet, but at the end of treatment, they have managed to achieve a very good lip seal. But I want to draw your eyes to the more important factor here is that functional appliance therapy actually will open up the airway. You can see before and after, there's significant widening of the airway space. So this child is essentially saved from having a lifetime of OSA and its complications. So what do the functional appliances look like? One very popular one is called twin block. It's called twin block because there's two pieces involved, and there's this palatal expansion device with screws, and the patient will be adjusting these screws at various intervals. And some newer technology available now. This is available in the US by Invisalign company. I think a lot of you have heard of Invisalign. They have come up with functional appliances themselves. And as far as I know, they are going to be released in Singapore later this year. It's going to be available here. And they are actually producing disposable appliances that comes in a series of palatal expanders, and I think this would be good in terms of patient compliance, and patients who constantly lose their appliances, at least this one, they will have a new one every single month. So what happens if the individual is not treated? If this is not addressed in childhood, they didn't have a chance to do orthodontics and functional appliance therapy, it's carried into adulthood, okay? So the patient will develop long face syndrome, and it's also called adenoid facies, okay? Because it is associated with adenoid obstruction. And you can see that the open mouth posture, the deficient lower jaw, as well as the overjet is carried into adulthood. So just to recap, blocked airways and OSA in childhood would lead to mouth breathing, and then that leads to abnormal jaw and face development. And when you carry this into adulthood and it's not treated, you have worsening of blocked airways, increasing OSA severity, and that leads to multi-organ system impairment when you're an adult. And just as Dr. Wong touched on previously, the reason why it affects so many organs in our body and so many organ systems is because the lack of oxygen at night during our sleep. And when you're an adult, OSA is associated with so many medical conditions. And often the relationship is often bidirectional. So that means OSA can worsen the medical condition, and the medical condition can also worsen the OSA. So often patients end up in a bit of a vicious cycle, okay? So in adults who did not have the opportunity for functional orthodontics in childhood, what can they do? They can address the facial abnormality and the breathing issues using orthognathic surgery. So this is basically called jaw surgery, and it is used together with orthodontic treatment, and you can get very nice outcomes in terms of facial aesthetics. But what happens internally? You can see that you get dramatic increase of the airway space. Okay, so this is a very beautiful result where the patient post-operatively, the airway space is opened up tremendously, and studies have shown that the success rate of treating OSA, we're talking about curative, okay, treatment, is 90 to 98% with orthognathic surgery. But you can see from all the bone plates, this is not for everyone, obviously, okay? So I also want to make a statement here. Be wary of treatments claiming to grow your jaws or expand the palate without surgery in adults. This is not possible because adults have stopped growing. The only way for functional appliances to work is if they are used on growing children, okay? So you can see soft tissue profiles, lip seal. The man who has gone through the surgery looks a lot better. He's grown a chin as well, but we know now that the soft tissue changes internally actually is the most important thing. So my recommendation to parents, please watch out for these signs. Heavy breathing, especially during sleep, snoring during sleep, or bedwetting beyond, bedwetting in school-going children beyond the normal age. You need to notice mouth breathing early. Recognize the open mouth posture, especially if a child has frequent illness or chronic blocked nose. Okay, we're not talking about having a blocked nose for a few weeks. We're talking about blocked nose for years. This is how these changes can occur. And as mentioned in the previous talk, the cognitive issues are at play here. When a child has OSA, it disturbs the sleep, it disturbs the oxygen supply to the brain. There will be brain fog, and you will see this reflected in poor school grades and also behavioral issues. So I just want to reiterate, yes, often OSA manifests as ADHD symptoms, especially in children. Adults will normally feel very tired, very fatigued, but children often have hyperactivity and aggression, and sometimes they are misdiagnosed as ADHD. So it's really important to recognize that people with ADHD diagnosis should get their sleep checked out, because there is the potential that OSA and ADHD can be occurring at the same time, okay? So, and also check, is your child reaching developmental milestones, or is the growth delayed? Because in certain stages of sleep, especially the deep sleep, there is peak release of growth hormone. And if your child is having OSA, they're not achieving the sufficient amounts of deep, slow wave sleep, and they are not receiving that growth hormone signal to grow. So what can you do? You can bring your child to ENT, which is the ear, nose, and throat specialist, for early assessment when you notice mouth breathing or chronic blocked nose. Also, the child should see an orthodontist. And if you notice the open mouth or already formation of the increased overjet with the front teeth sticking out over the bottom teeth, ideally we want to see the children at age 6 to 7 or 10, 11, because to optimize the treatment, you want to sort of tag on to the periods of growth. So an easy way to remember this, as one of my orthodontist friends likes to say, is remember 7-11, okay? So those are 2 times during childhood when you can actually successfully do functional orthodontics. And if it is not done, then it leads to adult OSA. So what do adults experience? Commonly, they will have snoring, grinding the teeth, frequent visits to the toilet. Daytime, they will complain of brain fog and excessive daytime sleepiness. Now, this is very different from feeling tired at the end of the day or feeling, sleepy after lunch. This is pathological sleepiness. These patients are waking up feeling drained the moment they wake up, okay? And this definitely is not normal, and it indicates an underlying problem. So, as said before, untreated OSA affects multiple organs and multiple organ systems, brain function, and your immune system. And this is a huge long list of things that can arise due to OSA, and it's not a complete list. But I just want to highlight what I think are a bit more concerning to people, which is we could look at increased risk of heart attack and stroke, as well as sexual function. It affects, causes erectile dysfunction. Also, it affects your immunity. That's why we have elevated cancer risk in OSA patients. Cognitive function will affect your work and your school performance. And most importantly, I think it increases the risk of road traffic accidents. So somebody's problem, someone who has OSA, suddenly becomes everybody else's problem if they're behind the wheel, okay? And this is because, brain fog coupled with extreme tiredness, the driver will have micro sleeps, and that's what gives rise to road traffic accidents. So emotional stability is also an issue. There's a good number of patients with OSA and sleep breathing disorders who have anxiety and depression, and I'm sure our psych colleagues here see often these cases in the clinic. And of course, chronic fatigue. Patients with OSA are definitely not going to be living their best life. They will not have energy in their work or for their family, okay? And just general poor quality of life. So how is it treated? The gold standard of treatment is actually this device here. It's called continuous positive air pressure, CPAP for short, where you wear this device during the night and it actually blows air into your airways. Alternative treatments are oral appliance therapy, and this is what I do in the clinic, as well as different kinds of surgery. So how does the oral appliance work? So when we're asleep and we're lying down, you can see that the tongue and all the soft tissues actually flop backwards, and it closes up that airway, and sometimes completely. So an oral appliance, when it's worn, it actually holds the jaw forward and prevents that tongue and all the soft tissues from blocking that airway. It keeps that airway nice and open. So here are just some quick facts. Oral appliances actually treat both grinding and OSA, and it is seen quite frequently in OSA patients. So they are very convenient to use. They are small, they're portable, they're non-invasive, and patients have actually shown greater compliance with oral appliances. Even more so than a CPAP, I think on a local context, there was a study done in 2023 by SGH, and they found that 70% of CPAP patients actually stopped using it because it was too uncomfortable. But there are patients who do get along well with it, and that would be ideal. But we don't live in an ideal world. So now we have oral appliances that can help these patients who are not able to tolerate CPAP treatment. So the problem now is that awareness is still very poor, even amongst dentists and doctors. So I just want to highlight the importance of early screening and detection. So now you know, in order to prevent lifelong worsening adult OSA and all the medical conditions that can arise, it's really important to intervene, screen early, and provide curative treatment. And then that patient will be able to grow up and avoid the need for CPAP and surgical intervention in adulthood. So there is a huge global burden, as it was mentioned before. Actually, in 2019, we were approaching 1 billion people, 1 billion with a B, with OSA. By 2020, we had reached 1 billion, and about 450 million people in the world have moderate to severe sleep apnea. So there is a huge global burden, and the PSG, or polysomnography test, is the gold standard in testing. And you can see this diagram on the right side here that involves a lot of equipment being attached to the patient. So this is not always convenient, and often cost is a factor for some patients. So, and we want to be able to screen patients for this disorder. It's very difficult to be able to do that using a PSG, okay? So there is a need for convenient, portable, easy to use sleep apnea testing for screening. And that's it being in use now with high resolution pulse oximetry. And this is what we are doing at my clinic currently, where we are screening patients for risk, okay? So patients who are snoring or have daytime symptoms, I would highly recommend that they screen, or even people who are seeking basic health information, okay? We do health screening all the time. We screen for other conditions like cancer, diabetes, and cholesterol. So I think, you know, sleep disorders are no different. It should be treated as important and should not be ignored. So this is the example of what a high-resolution pulse oximetry sleep test device looks like. You do away with all the wires, and it's as accurate as a level 2 test, and it addresses the need for low cost, highly accurate, and a portable, convenient test. The patients can do it in the comfort of their own homes. And it's actually ideal for people who are not able to wear multiple testing equipment while they're asleep. So it's able to generate a very comprehensive report, and I will interpret the raw data for patients in the clinic, and we'll have a very good idea of whether they fall in the high risk category or whether they are actually obstructing in the night. So now you know, seeing your dentist is not just about your teeth. We are the only clinician that patients see for no reason at all and very regularly. So you see your dentist just for checkups. You're not necessarily having a problem. So that puts us in a very good position to screen for conditions like oral cancer and airway obstructions. We can also see the first signs of medical conditions such as diabetes, even pregnancy. And we are able to monitor for signs of mouth breathing. So if you're not able to recognize it, we are able to help observe and monitor these things along with the growth of your child's face and their jaws. So at this point, it's important to also add in that dentists are now able to conduct screening and detection of sleep disorders through facial examinations. We do a thorough sleep history, and I do subjective and also the overnight test. And it gives us a more complete picture of the patient's risk. We are not diagnosing, this is screening. And if the patient is found to be at risk, they'll be referred on to the appropriate specialist. And usually I will work in conjunction with orthodontists and ENTs most of the time. Okay, so with this, thank you for your time. I'd like to share my website. I have a lot of patient resources if you want to read further. Thank you.
Thank you, Dr. Elaine. now I think y'all will see your dentist in a new light, isn't it? Right. So I'm very happy that Dr. Elaine has taken time to share this with us. So next up, I'm very excited, right, to share with you our next speaker. He is none other than my co-founder, Dr. Julian Lim, right? So he is the lead sleep psychologist and co-founder of Somnus Sleep Wellness. He is also regarded internationally as an expert in mindfulness and sleep with over 40 peer-reviewed publications and a position on the editorial board of the scientific journal Mindfulness. He is currently an adjunct professor at the Center for Sleep and Connection at the University of Singapore. So let's welcome Dr. Julian Lim next to share with us what we can do to restore healthy and satisfying sleep once again. Dr. Lim, please.
So thanks again to everyone for sharing your Sunday afternoon with us. I'm going to be telling you a little bit about insomnia, a little bit more about insomnia. You already heard something from Dr. Wong, but I'm going to be talking to you from the perspective of a sleep psychologist and telling you about one of the main philosophies I use with a lot of my clients who come to me with insomnia, which is helping them to see that there's nothing broken about their sleep, but that to heal their insomnia, what they really need to do is to learn how to trust their sleep again. So I think all of us have a pretty good idea of what good quality sleep is like. So we can imagine going to bed, falling asleep quickly, sleeping soundly, and waking up in the morning feeling nice and refreshed. Unfortunately, many of us don't get that kind of sleep. And for people who suffer from insomnia, that can be quite the opposite. So in fact, many of my clients see sleep almost as a kind of a battle at night, and the bed is their battleground. And when night starts to fall and it comes time to go to bed, they're like, oh my gosh, I have to put on my armor and get ready for another struggle with bedtime. And that's really not how things ought to be. And what I try to do with my clients is to help them with those thoughts, help them with those behaviors to get their sound sleep back again. We've already heard a little bit about what insomnia disorder is. Many people use the word insomnia quite colloquially, but in terms of psychological diagnosis, there are a particular number of symptoms that need to be checked off. So usually people will come in having difficulty falling asleep at night or difficulty maintaining sleep, so waking up often during the night and being unable to fall back asleep again quickly. This usually happens quite frequently, so more than 50% of nights. It has to affect daytime functioning. So people with insomnia would usually say they have difficulty concentrating or they have poor mood. It affects their work, their school performance as well. And this, of course, can be acute. So adjustment insomnia happens usually over weeks or months. But what I want to talk about more today is the kind of insomnia that persists over time. So the kind of people who find that they have these difficulties sleeping over months, sometimes over years. So I think to understand trusting sleep a little bit better, I want to use an analogy, which is from golf. So maybe just hands up in the room, like how many of you actually play golf or have played golf before? Just quick show of hands. I'm sure among 50 people, some of you have played golf, surely. All right, so maybe everyone's really shy. I don't play golf myself. I kind of hate it actually. So I tried to learn a little bit when I was younger. It was like the worst 2 hours of my childhood. So I'm not a golf player, full confession. But there is a very interesting analogy to be seen in golf, which is that among many top-level players, they experience this condition that's known as the yips. And the yips in golf happen when these players are trying to make very, very simple shots. So just strokes that they've practiced, thousands, tens of thousands of times in their training. And they come to a tournament or a competition and they have to make these really, really simple strokes. But because of the stress, because of the pressure, they start to pay attention to what they're doing. And when they start to hyper-focus on what they're doing, that's when things can go really wrong. And I have a video of a really famous example of this, which happened to poor Ernie Els, who some of you may know is a top golfer. And this is what happened to him in a tournament.
And by the time Ernie is done, he's 6-putting from less than 2 feet. Unfortunately, that's happened to an awful lot of players at some point in time in their career. Quite often it ends up with a few backhands involved, which he will try later on in this. But he steps away, gathers himself, and I can't even imagine how the wheels are spinning in your brain. This is the first hole, and he's not even touching the hole, and then here, he just, oh, God.
So that's the kind of thing that you don't want to happen to you in a top-level golf tournament. But what does that have to do with insomnia? Essentially, when a process is simple, natural, and automatic, when you try to add stress to it and you try to put effort into it, that's often counterproductive. And exactly the same kind of thing happens to people who start to suffer from insomnia. Insomnia is a natural, simple, well, sleep is a natural, simple, and automatic process. And when we try to think too hard about it and we try to put effort into sleeping, that's where things can really go off the rails. Insomnia essentially is a disorder of hyperarousal. And what we mean by that is that instead of relaxing at night, when we get into bed, people with insomnia feel that their fight or flight system starts to come online. The fight or flight system, as many of you have probably heard, is a system that comes on when we are trying to respond to threat. So if our boss is yelling at us to get something done, if we think about our caveman ancestors having to deal with tigers coming to attack them, the fight or flight system evolved for us to be able to cope with these threats. It mobilizes our resources so that we can deal with these situations. And that's exactly the kind of thing we don't want to happen when we're trying to sleep. Why does it come on? Well, essentially, the fight or flight system is fueled when we try to sleep instead of allowing it to just happen naturally, as healthy sleepers do. So what you'll see with a lot of people who come into the clinic with insomnia, they often have very high levels of sleep effort. They also have a lot of unhelpful thoughts and beliefs about sleep, which I'm going to go more into in just a while. And on top of that, they have a lot of unwillingness to change these habits and patterns. So they start to think that these thoughts that they're having, these habits that they're having are useful to them, and that if they continue to do them, if they just try maybe a little bit harder, then their sleep will get better. And they don't realize that exactly the opposite is the case, that all of this sleep effort, all of this trying, all of these beliefs are paradoxically what's making the sleep worse and causing the insomnia to persist over such a long period of time. So what can we do about that? One of the approaches that I use and that has been shown to be really effective for treating insomnia is a treatment known as cognitive behavioral therapy. And at essence, as I've said, what this really is about is helping people to relearn how to trust sleep as a natural process, rather than something that they have to strive to achieve or that they have to try to do. There's a number of components to cognitive behavioral therapy for insomnia, and a skilled therapist will be able to assess what's going on with a particular client and help to kind of pick and choose the components that work best for them. So one of the really important components of cognitive behavioral therapy is helping people to reset their sleep habits. And so some of the things we might do in session, for example, would say, well, maybe if you're not feeling sleepy, don't go to bed. One common habit that you'll see in insomnia sufferers is that they'll try and make an attempt to get more sleep by going to bed earlier. So habitually, their bedtime would normally be 11 p.m., but they find that, oh, I'm having so much difficulty sleeping. Maybe if I go to bed 2 hours earlier at 9 p.m., that will help me because I have 2 extra hours in bed. And again, that sleep effort paradoxically makes insomnia worse. So don't go to bed if you're not sleepy. We also talk about, well, don't stay in bed if you're not sleepy. If you're lying in bed tossing and turning, maybe get out of bed, do something else, wait until you're feeling sleepy instead. And the kind of overarching principle of those two things is to help people to get better sleep quality first. So to help people to associate the bed as a place of rest, as a place of sleep, and then once we restore that sleep quality, to start to build the sleep quantity up again. Apart from resetting sleep habits, we also talk a lot in session about challenging some of these thoughts and beliefs that people have about sleep that may not be particularly useful. So I think Dr. Wong shared some of those earlier in his talk. So you might see people who come in and say, well, if I don't sleep 8 hours tonight, tomorrow will be utterly ruined. If I don't have a perfect night of sleep, tomorrow is going to be terrible. And so what we might do is, well, gather the evidence for that. Is that always necessarily true? Are there times when you haven't had a full night of sleep, but you still were okay the next day? Other kinds of thoughts and beliefs: my poor sleep is destroying my physical health. So you have people who are really worried that they're not sleeping well, they're going to get diabetes, they're going to get cancer, they're going to get all these terrible things. And again, ironically, worrying about those really awful consequences of not being able to sleep in the long run is the fuel that kind of keeps that fire of insomnia going. So again, this is something we can work with to try and figure out, is this really helpful for you to be in bed thinking about getting cancer if you're not going to fall asleep in the next hour? Probably not. In addition to cognitive behavioral therapy, one of the additional approaches that I use is a technique known as mindfulness. And for those of you who were here at the start of the session, you had a chance to hear Eric go through a mindfulness practice. Many people have sort of heard of mindfulness and think of it as kind of this really complex, semi-spiritual thing that is really hard to attain. In reality, when you boil mindfulness down, it's actually not really that complicated. Mindfulness, honestly, is mostly about awareness of the present moment. So rather than spending time up in your head, worrying about the past, thinking about the future, bringing yourself to the present moment and seeing what's here now. And importantly, seeing things as they are, rather than imagining how we want them to be. And teaching people the skills of mindfulness can be another very useful tool for helping them to cope with their insomnia. So for example, if we think about the thoughts that insomnia sufferers have that lead them to hyperarousal. So in the orange box on the right, what if I don't get enough sleep tonight? I need 8 hours of sleep. Why can't I fall asleep now? Those thoughts spinning around in bed at night cause people to try very hard to sleep, which we already know turns on the fight or flight mode, which makes sleep even harder to attain. And if instead of doing that, we help people to be mindfully aware of what's going on, they might change their thoughts to something like this. I wish I was asleep at this moment, but I don't really feel sleepy right now. Maybe I should just get out of bed. And let me take this moment by moment and see what happens as the night unfolds. And having this mindful awareness really, really can help with people achieving the kind of peace they need to be able to fall asleep quickly, to shut off these arousal, these kind of systems that keep us awake and switch us into the mode that allows them to go to sleep. So just to wrap up, I want to conclude by saying that if you feel like you have insomnia, or if you know someone who does, first of all, rest assured the problem is treatable, so don't feel like you have to suffer in silence. The second message is that there's nothing broken about your sleep. There's absolutely nothing wrong with your sleep. The key to healing insomnia is to reduce hyperarousal and to learn how to regain trust again in your natural sleep processes. And finally, cognitive behavioral therapy is often the preferred solution for many insomnia sufferers to help them out both in the short term and to prevent relapse from happening in the future. And that's all I have to say for now. And I will turn the time back over to Eric.
Thank you, Dr. Julian, for sharing with us, how we can begin to shift our perspective, right? Our mindset from trying to fix our sleep to trusting our sleep once again. And I think that's where, the mindfulness practice is so important for us to tune into the body, tune into what the mind is saying, right, at a point in time when we are struggling with falling asleep, right? So I think this is where I'd like to segue into our next speaker. So Dr. Naras will be sharing with us on eating well for better sleep and longevity. So are you mindful of what you eat? Do you know that when you don't get enough sleep, you may find it difficult to make healthy food choices, and this results in poor sleep and poor diet negative spiral? So I'm very excited to welcome Dr. Naras to share with us what diet strategies can aid us to improve our sleep and optimize our health. Dr. Naras is the Chief Clinical Officer at Chi Longevity, Asia's first science-driven, medically led healthy longevity clinic. He has a Bachelor of Science Molecular Genetics, a master's degree in nutrition and dietetics, and a PhD in medicine. He is also accredited practicing dietitian in Australia, board certified in both Australia and USA in regenerative and anti-aging medicine. So without further ado, let's welcome Dr. Naras. Over to you.
Thank you, everybody. So I think that we all have a pretty good grasp that we need to have good sleep for our physical health and our mental health. And as a dietitian, and also as now such a big interest in longevity, we really are starting to understand that it's not just physical and mental health. Sleep is really important for longevity itself. And if we want to have a long and healthy life, it's one of the pillars, in addition to many others, that can help us achieve that. And so I see clients on a day-to-day basis, and sleep is something that I talk about significantly, and I do like to relate it back to our eating patterns. But just as an aside note, I suppose, is how and why do we think that sleep can play a role in longevity, or a lack of sleep could then impinge our ability to live a longer life? We know that when we are sleep deprived, we have increases in inflammatory markers, and chronic inflammation is one of the hallmarks of aging and predisposes us to many of the health conditions that some of the other doctors have spoken about today. We also know that when people are sleep deprived, or we've seen this in animal studies at least, that right down to the level of DNA damage can occur as a result of chronic sleep deprivation. We've had, again, one of the speakers has talked about when we are sleeping, the early hours of sleep is where a significant amount of hormonal action, particularly growth hormone, is secreted. This in its own right can have long-term impacts on the aging process. And for those that have looked into the mechanisms of aging itself, we know that telomeres, which can be shortened as a result of short-term and even long-term sleep disturbances. So this is where my interests lie. What I'd like to talk about today, really just on a few fronts. We've only got 15 minutes or so to talk. I'd like to talk about the foods and the eating patterns that can promote and help sleep. On the flip side of that, I'd also like to talk about some of the things that we need to think about avoiding or reducing, and then other aspects of how we go about sleep, of how we go about eating, and sort of the patterns that we make, and whether or not they also can be impacted. The first that I'd like to talk a little bit about when it comes to ways that we can think about the types of foods that we can eat in order to help us with sleep is foods that are containing this amino acid called tryptophan. So tryptophan is what's called an essential amino acid. One of the other speakers today actually told us in the brain where tryptophan plays its role. So what we know is that, and I'll talk in a moment, there are certain foods that are high in tryptophan. Tryptophan itself is important in the production of something called 5-HTP and some of the neurotransmitters, serotonin, which we know plays a role in onset of sleep and sleep quality, as well as production of melatonin, which, again, one of the speakers was speaking about, is produced in the pineal gland and is responsible for part of our circadian rhythms and our sleep-wake cycle. So as the title of my talk saying this is a two-way street, this is the positive side of that two-way street, that when you are promoting certain foods that can then have an impact on certain pathways, that those pathways can then have a good outlook on how we end up sleeping. So where do we get these tryptophan-rich foods? If you look down onto the left-hand side here, you can see that it's actually not difficult. And I don't want to be another dietitian that just harps upon healthy eating patterns, but just look across and see where are we getting tryptophan-rich foods. So animal product, turkey we know is quite high in tryptophan, but actually most animal products have a reasonable amount of tryptophan. But you don't have to be an animal product consumer, an animal protein to get tryptophan, because actually if you see down the bottom, soybeans also are a good source of it. So if you have a diet that has a good variety of different protein types, it can also be the edamames and the tofus and the tempehs. It doesn't have to be an animal predominant eating pattern. Then consuming whole grains, oats, quinoa, buckwheat, nuts, seeds, other vegetables, leafy greens, mushrooms, certain types of fruit, kiwis, pineapple, banana, plum. All of these foods are good sources of tryptophan. And in fact, it just comes back to looking and thinking about how you choose to eat through the course of a day. And are you incorporating some of these foods? Something that I found very interesting when I was researching for this talk was, when should we be having tryptophan-rich foods? And quite often when we think about our sleeping patterns, we might think about, well, what should or shouldn't we be eating just prior to going to bed, our evening meal? But with tryptophan foods, it's not necessarily the case. It's having it through the course of the day is important. So even if your evening meal may not contain, of course it should have these things, it's not so critical, because actually we need to have the serotonins and the melatonins being stored in these various glands. So actually getting them in through the course of a day can be really important. Another way, looking from a food perspective, is complex carbohydrate-based foods. So we, again, talking about that two-way street, what we do know is when people are eating really highly refined foods, highly sugared foods, foods that don't have a lot of fiber in them, these types of foods can have a real impact on our blood glucose levels. And when you consume these sorts of foods in the evening, we know that your sugar profile through the night can be very different from when you are eating foods that are more fibrous, that are not highly refined. They can have a very, very different night profile. And when you have a sugar response in the evenings that is much more regulated and doesn't have these spikes, this can result in a far better quality sleep. And so then the message here is, now when we do start to think about what might be better foods to have in an evening, is to start thinking about the carbs that you eat. The Singapore diet loves more highly refined carbs. The noodles and the white rice and the cup noodles, etc. Eating in hawker centers, lots and lots of refined carbs and sugars. Just remembering that we can always take that step back a little bit and saying, not all the time, but sometimes, could I actually have something that's a little less processed? Trying the quinoas, trying the brown rice or the black rice, looking for more whole grain products. As I said, this is where the plant proteins can play a really good role, the dals and the chickpeas and lentils, etc. Making sure that you have a good variety of vegetables. fruits after dinner, not too much. But if you can recognize the food that you are eating from where it came from and having less processed food, you're going to find that you're getting more complex carbohydrates. And as a result, glucose control, sugar control through the evening is going to be different. And that's going to have an impact on your sleep. So not difficult, but again, simple messages. The very first picture that I showed, where it showed you that tryptophan to 5-HTP to serotonin to melatonin actually needs to have other things which are called cofactors to help that along. B vitamins, magnesium is one of them. And so again, I wanted to just show simple things today so that we have practical tools in order to help us sleep a little bit better, is to think a little bit about, well, perhaps magnesium-rich foods are also worth considering. In general, we don't have great deficiencies with magnesium. And I looked at sort of Singapore population data, and on the whole, Singaporeans are not too deplete in magnesium. However, globally, it is starting to change somewhat, and there is a little bit more magnesium deficiencies. Magnesium, again, it's an essential mineral. So a little bit like I mentioned, the tryptophan is you need to get magnesium from your diet. Your body's not going to make it yourself. It's very important in regulating lots of different chemical messengers. It's important in muscle relaxation. And as I said, it's really important in the production of serotonin and melatonin. So again, simple foods. Legumes, a good source of magnesium. Oily fish and mackerel, good sources of magnesium. Nuts and seeds. So here, several times now, nuts and seeds have found their way up and found their way in. Leafy greens, of course, different types of fruit, magnesium-rich foods. And we're not talking today about supplementation, etc., but I'm sure lots of you have noted that sleep aids have often talk about magnesium as being something that helps in that sleep. We can do that from food. As you can see here from the list, these aren't complicated. And it wouldn't be very hard to look at your eating patterns and to say, are there things that I could eat in the evening, or I could have at dinner, or I do have as a small snack that could have an impact tonight that would help with my sleep? Can I also look across the course of the day and what are my general eating patterns like? So from my perspective, this is quite low-hanging fruit and not difficult. Taking it from the other perspective, what are some things that we need to think about, perhaps, when it comes to having a better night's sleep, short-term and both long-term? Well, I've already said that when you're consuming more highly refined foods, these can have that impact on blood sugar levels at night. And so, again, look at what you're having with your meals. What are you consuming with your meals? Are you drinking sugary drinks? Are you having bubble teas at end of day? Your children choosing to snack on cookies and sweet foods and not necessarily eat the healthier foods that, as a parent, you might be trying to produce for them. We have to keep an eye on caffeinated products. So something that we know about caffeine is that we all metabolize caffeine differently, and caffeine is a stimulant. So for some people, what's called a half-life for caffeine is anything up to 6 hours, which means if you're having something that's significantly caffeinated, 6 hours later, you still have half of that in your system. 12 hours later, you have a quarter of it in your system. So think about if you are someone that does consume coffee, even green tea for that matter, black tea, caffeinated drinks, timing of which you have them, and at what point should you perhaps think about having a caffeine cutoff. One of the speakers has spoken about alcohol, and we know that alcohol is a diuretic. So again, that could be one of the reasons that causes you to wake up in the night to go to the bathroom. It's a depressant. Yes, it might make you feel like you've fallen asleep and have a deeper sleep, but it really has a negative impact on your sleep architecture. So how much alcohol you consume, when you consume your alcohol, without a doubt plays a role on sleep quality. And then there's lots of other things, because as I said, it's not necessarily just the food itself. It's large meals, this is at night, late meals, rich meals, oily meals. All of these types of things can have an impact on our digestion. And in fact, if you go to sleep and your body is actively still working on digestive processes, then body temperature can be higher, heart rate can be higher. All of these things can have an impact on how well you fall asleep. And also then just the symptoms that some people might get of reflux, for example, when you eat these types of food. That sort of discomfort can also play a role there too. And if you are somebody that has a disposition towards reflux, then thinking about those spicy meals again. Another point to remember is we live in a world now where there's so many different diets that we are trying. Some people are enjoying, very high protein diets or particularly low carb diets and having a good impact on their body composition, etc. But are they having a good impact on your sleep? And so if you have a more radical type diet, and perhaps you can see that sleep patterns might not be quite so good, you might reflect and have a think on that side too. As you saw, some of those complex carbs, some of the tryptophan-rich foods are coming in from carbohydrates. So if you periodically have very, very low carb dinners night after night after night, perhaps the little inclusion of some carbs sometime might actually have an impact that's positive on your sleep. So keeping it short and sweet, we know, and if you have a think a little bit about how healthy is my eating pattern, how balanced is my eating pattern, will that help promote a better sleep? On the flip side is if you don't sleep well, what do we tend to do? We tend to actually not eat well. If you don't sleep well, you might consume more caffeinated products to keep yourself through the day. If you're not sleeping well, you're more likely to eat more sugary foods and more refined foods in order to get yourself through the course of the day. If you don't sleep well, big, rich meals at night sometimes help relieve stress, then that could have a negative impact on your sleep. And so you have that cycle on the other side. And it's getting yourself to the place where you're doing the right things more often, which improves the sleep, and then it becomes a lovely circle in the direction that you want it to be. That keep an eye on your caffeine, keep an eye on alcohol, look at what happens at night, how big is my meal, how rich is my meal, what is the timing of that, what is the type of diet that I am having, and is it actually the right type of diet for me? Please feel free, if you've got questions, by all means, message me. And again, thank you very much.
Thank you. Thank you, Dr. Naras, for sharing with us a little bit more into the food that we can take, right, to help us with our sleep at night. And, with the tryptophan-rich food, the magnesium-rich food, I think it's, as what you mentioned, right, it's not just about, putting it all at the end of the day, right? But really looking at it from the time that we wake up in the morning, right? And making a mindful choice in terms of how we intend to nourish ourselves, right? So it's not just for the body, but also for our mind. And speaking of mind, our last speaker for today is Ms. Ratna, and she is the CEO and founder of the Mindgem. A TEDx speaker, a LinkedIn top voice, facilitator, and trainer, she is passionate about helping individuals and organizations to find their inner strength, rise above stress, and build resilience and strive in work and in life. Having went through a life-changing inner transformation journey through mindfulness, she dedicates her life to empower more people to design their life intentionally, at the same time make a difference to the organization and community they serve. So over to you, Ms. Ratna. Take us through.
When Eric invited me to share here, I was like feeling a bit impulsive because I'm the only one who is not doctor. I'm the last speaker as well. I hope that my sharing will not make you sleep. Just before we start, as well. Please connect with me on LinkedIn if you have not. I share quite a bit of content, um, sharing about well-being and career development. So just let me share a little bit more about background about myself and why I do what I do, right? And I'm a well-being strategist and I run the Mindgem. Basically, we are a mission-driven learning and development organization that aim to empower people and organizations to elevate their well-being and build high-performing teams. So we basically run different kind of well-being programs from stress management, energy management, building healthy habits to leadership and team development programs. And that's the reason why I hope to share a bit of like insight from what my interactions with the workplace as well and what people are struggling outside with and how mental fitness is such a crucial part of our well-being and why we should really pay attention to it to help us in improving our life and well-being. So how it started and why I'm actually so passionate about this topic and how it literally changed my life. So when I started, I was actually, if you're wondering, I'm not Singaporean. I'm Indonesian. I came to Singapore about 18 years ago, and I could barely speak English well. And because of that, I was really struggling a lot, even communicating with people. And on top of that, I used to have a fear of public speaking, right? And because of that, it would literally crash my self-confidence and self-esteem. And I used to fail my English oral test, and because of that, I was like not being able to really speak well in public, especially. And when I came to Singapore and struggled with my limited English and all that, and I graduated from the uni, and I decided to actually join this training consulting firm. And I didn't know as a marketing executive, and I didn't know back then I had to do a lot of actually public presentation. And it's not like a 20, 30 page, right? It was really like a 150 to 200 page and concept convention. So it was really a nerve-wracking experience. And because of that, I was looking out for ways to actually help me overcome my fear of public speaking. And that brought me into joining a Toastmasters. It's a public speaking club. So from, doing one speech into winning public speaking competition is something that I really never thought possible. But not only that, this journey has brought me into basically, hosting weddings, hosting corporate events, and training for the Toastmasters community as well. And the reason why it helps me a lot in overcoming my fear of public speaking, and one of the reasons why I had this breakthrough is because of the mindfulness practice. And I think Dr. Julian mentioned earlier about mindfulness and how it basically helps us in improving our well-being. And mindfulness has literally helped me a lot in not only improving my well-being, but it's also creating a breakthrough for my life as well. And that's the reason why I discover my passion and purpose in helping people to overcoming their anxiety, overcoming their obstacles to this powerful practice so that they can change their life for the better. And especially, in our society where we have so many things to do and we also juggle with so many stress as well that sometimes it causes a lot of problems and it also, in the end, right, cause us to not being able to sleep well and take care of our well-being as well. And that's the reason why I'm really very passionate about the practice of mindfulness because it has literally changed my life. And not only that, it has, I started, sharing about the benefit of mindfulness, how it really changed my life for the better. I started doing training as well as giving keynote to corporates as well to share the powerful practice of this mindfulness. And didn't know as well, my story was being featured by a couple of media, and then being able to speak on TEDx was really painful, and not recently as well, I was being recognized as a leader for voice that the face of mental health. And I think not trying to boast about this, but I think this really something that I wanted to use in such a way that to be able to really benefit more people so that they can really take care of their well-being and improve their life. And yes, so today we are going to cover 3 areas. The first one is how can we understand mental fitness and the impact of mental fitness on sleep, and how can we also basically apply some of these practical tips to enhance our mental fitness for sleep wellness, but also at the same time overall well-being. So let's take a look about the understanding what is mental fitness all about. So just like our smartphone, right? Like we use our smartphone for WhatsApp, for calls, for using a different app every single day from morning to night. And at the end of the day, we need to really charge our phone so that we can use it again the next week. And that exactly applies to our mind as well. And that's the reason why we need to take care of our mind so that we can recharge and refresh every single day to be able to also think clearly, make decisions better, as well as manage our emotions more effectively. And just as we care for our smartphones by keeping them charged, we also must take care and prioritize the health of our mind. And that's where the mental fitness will come into place. And let's think a little bit more about what mental fitness is all about. We all talk about, physical fitness, and mental fitness has been spotlighted, especially recently during the COVID time. And basically, mental fitness is really a state of well-being and having a positive sense of how we feel, think, and act. And that's the reason why we take a look at different components of mental fitness. The first component is really our emotional, the sense of self-esteem, self-acceptance, as well as our resilience towards challenges that we face in our life as well. I think I shared a bit more about a couple of my challenges in overcoming my own self-esteem as well earlier, and how it really affected my life and well-being, also my sleep as well. Many times I just cannot sleep at night because I feel so anxious about so many things that I, encounter in life as well. And the second part is as well, the second part is social in terms of your friends and your support and network. And I think thinking through about some of my past experiences as well, struggling with relationship problems, right? I mean, all deal with different people in our life, even with, a colleague, or even our boss, or even our partner as well. I think a lot of times when we encounter these problems as well, it can affect our social well-being as well, right? And it also affected our sleep as well. And the third part is financial, in terms of low levels of stress due to money issues and having in control with our finances as well. Just thinking back as well when I started, building my own business as a solopreneurship, financial is something that is also, kind of like, thinking a lot about. And because of that, I also felt so much stress because of, struggling with, how to keep things going and all that. But I think after a few years in building my business as well, I think things started to get better as well. Last but not least as well, in terms of physical, how can we keep, I think Dr. Naras mentioned about a healthy diet, regular exercise, as well as having enough sleep as well, and how having this physical fitness really helps us a lot in building our mental fitness at the same time. And and just talking about this as well, I remember a few years ago, before I started something on my own, I used to struggle. I used to actually suffer with a workplace burnout. I remember, I hope that no one will experience that, because it was really quite bad actually. I faced burnout, and it was just like it was really happening in my body. Right, I felt my heart beats faster than ever. Every time I had meetings, I just felt like, so yeah, there's a lot of those kind of like negative emotions that is not being able to, I just not being able to cope with it to the extent that I had to do like a stop to it. And so I decided to take a career break, and because it has really affected my well-being and life in such a big way. I cannot really sleep well at night. And that was really very terrifying, right? And that's the reason why I know that a lot of people are actually experiencing that. And I think how can we use some of the practices that the well-being practices to actually help us in improving our health and well-being, especially our sleep as well, because sleep is 1/3 of our life, right? It's so important. And I think that's the reason, that's really basically the mission that I have about really educating people on the importance of well. And like what I mentioned earlier, physical and mental fitness is really, the two sides of things, two different sides of the same coin. And it's so important to really pay attention to our mental fitness as much as paying attention to our physical fitness. So as much as we go to the gym to actually build our physical fitness, we also have to build our mind so that we can get stronger, more focused, sharper as well. So let's take a look at the impact of the mental fitness for our sleep. Like, talking to so many people in the corporate as well, I think so many people are struggling with stress. These are the problems that many people are facing in the workplace, from social isolation to disengaged to job insecurity nowadays because of the tech layoff, right? People are feeling so much insecure in the corporate as well. And that's the reason why there is, the topic of well-being is really being spotlighted. And the recent research by Potential Project, the study about the mind at work, how our sleep actually impacts our work performance. So the study has shown that 41% people who sleep less than 6 hours actually get distracted at work. And 35% after they sleep more than 7 hours, is actually being able to focus better at work. And women get less quality sleep than men, right? So basically, yeah. And last but not least is as well, people who actually work from home get less quality of sleep because they are not being able to really have a healthy boundary about work and life. And I think it's not saying that we need to go back to work, but I think as long as we know how to maintain a healthy boundary about sleep and work, this problem can be solved. So what is the positive impact of our mental fitness? So the first one is our emotional regulation. So we are able to maintain our mental fitness. We are able to regulate our emotions better. We are also being able to manage our stress better as well. Last but not least, we are able to think positively so that we can have a positive outlook about life. And let's take a little bit deeper about what are some practical tips that we can use to actually enhance our mental especially for sleep. So the first one is to exercise. So I spend about a couple of I try to make myself exercise every day, even for 5 minutes, because it just gives me so much energy, and also it helps me to sleep better. And I do gratitude journaling just before I sleep or even in the morning as well. So I will write 3 things. The first one is what are the three things that I'm grateful for today, the 3 things that I want to celebrate myself, and last but not least, what are the 3 things that I wanted to focus today or even tomorrow. So that's another one that I really like to do. And mindfulness exercise, I think Dr. Julian mentioned a little bit earlier about some of the benefit of mindfulness in helping us to improve our sleep as well. I just to also share a bit more about this case studies as well. So I have a friend who is in his late 30s and he suffered from kidney failure. So he went through a dialysis process, and because of the I think Dr. Wong mentioned a little bit about the drugs and all that, and because of the drug and the change of hormone as well, he cannot sleep well at night. So he was actually sharing about like, hey, is there anyone can help me to be able to sleep better at night, right? So I reached out to him and I said that, hey, here's the 2 audio on body scanning, a guided audio meditation. Please write it out and let me know how it is. It helps you to relax your body and helps you to sleep better, right? So 1 week or 2 weeks after that, he texted me back and he said that, hey, Ratna, thank you so much for sharing that. It really helps me a lot to sleep better at night. Just halfway through the audio, I fall asleep already. So I think that's really better. That's really very helpful. So body scanning practice really helps us a lot in relax our body, because a lot of times in insomnia and all that, it happens because there is a lot of tension in our body. By using body scanning practices, basically scanning every single part of our body and just relaxing our body helps us to feel a lot more relaxed and help us to sleep better. I think reduce screen time 30 minutes before sleep and maintain a consistent sleep-wake cycle. And last but not least is to build identity-based habits as well. Like, for example, when I started to want to improve my sleep as well, so I told myself that I'm a good sleeper. So I am committed to improving my sleep, right? So identity-based habits is a term that is being developed by James Clear, who is the author of Atomic Habits. He shared that to be able to actually implement habit that lasts, we need to basically build an identity-based habit. So really imagining ourselves and building that identity that we want to see for our lives and for ourselves as well. So having that kind of identity-based habits really helps me a lot to build a lot more sustainable habits that improve my well-being. Last but not least, just to share one of the PERMA model of well-being that is being introduced by Dr. Martin Seligman, who is the positive psychology guru. So these are the PERMA model help us in improving our well-being. So the first one is positive emotions. How can we develop that kind of like positive emotions so that we can have a positive outlook in our life, practice gratitude, exercising, and all that engagement, being completely engrossed in whatever that you are doing, like doing something that really brings you flow and happiness to your life as well. R stands for relationship, having an authentic and relationship, a loving connection with the people that you love, right? Making new friends, volunteering, as well as showing appreciation, thank the people that we love as well. The fourth one is PG having living with a sense of purpose as well. So, for example, contributing to a cause that really makes a difference. Also, as well as living according to your core values as well. Last but not least is to accomplishment, having a sense of achievement towards your life as well. Like celebrating small little achievement every day, like the gratitude journaling that I do at the end of the day. It's really to remind myself that, hey, what are the small things that I've accomplished today? And just doing that really helps me to elevate my well-being. And and that really helps me to sleep better for sure. Yeah. So I hope whatever I've shared earlier can help you in improving your well-being as well as improving your sleep wellness so that we can have a better life. So last but not least, I'm just going to give you this gift. My mentor, Stuart, and I put together this videos, the Ultimate Mindfulness Guide for Busy Professionals. So you can scan this QR code and then you can download it. feel free to reach out to me on LinkedIn, Instagram, and also there is my email.
Thank you. Thank you, Ratna, for that wonderful sharing. So right now, I'd like to take this time to invite you all to just take a very short moment to help us to do a feedback of today's session before we move into our live Q&A segment in the very last few minutes of today's session. So the link is actually in the chat as well as on your screen right now. So if you just take your phone to scan the QR code, spend about a minute to fill in. And if let's say you put in your interest, right, for our sleep screening that we're offering this month, you will receive an exclusive promo code, a discounted code for that. All right, so we have one question that has come in earlier, and that's directed to Dr. Elaine. It's regarding, is bed wetting an indication of severe OSA in a child?
The issue with urination in the night, it actually has to do with OSA because it actually is triggered by negative pressure in the airway, and it causes the release of a peptide called atrial natriuretic peptide, ANP. And that actually causes more excretion of water and salt. So that's why people urinate more in the night. So in children with OSA, this may be the mechanism by which they are wetting the bed.
For cases like that, one of them asked, should we bring them to ENT or orthodontist alone can help?
I think it's a bit sort of jumping the gun by just, you cannot attribute bedwetting to that straight away. I think it's important to go through a screening process because, there could be many reasons why the child is wetting the bed. So I think it's good to go through a proper process of screening. And for instance, like Somnus Wellness and also my clinic, we have screening processes which we can zero in on whether the cause is related to sleep and sleep breathing, or is it due to something else. So I think don't be quick to just immediately go straight to the specialist, but do go through the proper channels so that you can I guess save yourself some money and time by, finding out first, do you have risk? And if so, do the proper testing.
Thank you. Thank you, Dr. Elaine, for sharing that. So I think in closing, I would like to invite all of our speakers today, right, to share with us what is your sleep routine and share with us one last final practical tip to all of our audience this afternoon. So let's start with Dr. Wong.
I don't really have a routine. I've been very blessed to be a pretty good sleeper. So whatever I do, including having a coffee before bed, the moment I hit the pillow, I'm out within 2 to 5 minutes. So I'm quite blessed. Yeah. So maybe I'll let you know in time to come when I do run into problems.
Very jealous of you.
How about Dr. Elaine? How about you?
Okay, you know how people tend to be night owls and morning larks. I am the typical night owl. So we go back to research. Research shows us that night owls are actually more sensitive to blue light. Our photoreceptors are more sensitive to blue light, especially in the night. That's why we are night owls. Okay, and so I think, and I'm married to a morning lark, with a terrible combination. So I think for night owls, it's important to make things easier on ourselves so that we can get to sleep at the right time. So for me, what I do every night is I start dimming the lights about 1 hour to 1.5 hours before I want to sleep. And most of our light bulbs are actually LED these days, and that's very rich in blue light. So I have a lamp in my room, which is a warm light. So I switch off everything and I have that lamp. And that helps. And if my husband is using his handphone and it's blasting, a very bright screen, I will actually use eye covers because I can see the light through my eyelids. That's how sensitive I am. And if you have an iPhone, I just want to mention they have a really good mode that you can use. It's called night shift mode. I don't know if they had this on Android, but it actually, you can set the time. And so the light coming from the phone, they adjust the colors and the lights to be dimmer and more towards the warm tones. So that's actually very helpful too. I think for all us night owls, we have to use as many tools as we can.
Great, thank you. Beautiful. Yeah, for myself, so I have a young boy. His name is Erickson. So in case you forgot my name, My name is Eric, so my son, Erickson. So what we do is actually we have a night routine where the lights will gradually dim, right, as it goes closer to 10 p.m. So in terms of the brightness, we will slowly reduce in intensity, and you will switch from the white light to warm light, right? So that is a signal to help the whole family realize that actually bedtime is coming soon and begin to wind down as part of our bedtime routine. Yeah. Great. So let's hear from Dr. Julian. How about yourself? What's your bedtime routine and one practical tip?
Well, I think I've always luckily been one of the blessed ones as well. So I think with me, one thing is that I really kind of look forward to sleep. I quite enjoy it. And so I guess that helps as well. You know, I like being in bed and under the sheets and feeling nice and like safe and comfy. There was a period I guess I want to share where I had a bit of a chronic medical condition that affected my sleep quite a bit last year. And there was a period of a few months where I really kind of struggled because of that. And, you know, thankfully that's over now, but it really gave me a real appreciation of what it's like to kind of viscerally suffer with serious insomnia for the short term. And I think that's given me a lot of empathy, I guess, for people who are struggling with it. So, you know, I mean, my one tip would be what I said at the end of my talk, which is that you don't have to suffer in silence. You know, I know a lot of people who have a lot of difficulty sleeping, and for one reason or another, they just don't want to seek help for a really, really long time. And, you know, if there's anyone you know out there who's like that, my wish, I guess, is that you share with them that, you know, there are many, many solutions. There are many ways of dealing with that problem, and rather than suffer with it in the long term, to really get the help that you need.
Great, thank you. Yeah, so don't suffer in silence, right? There's always resources available. And I think that's where we have put together this webinar to raise the awareness of sleep and the outlets out there to get it screened early, right? So that we get it resolved earlier rather than later. Great, and how about Dr. Naras?
Well, I'm an early to bed and early to rise person. And my danger zone is that sort of 3-4 o'clock in the morning. If I wake up at 3 or 4 o'clock in the morning and it can be difficult to get back to sleep, that can be a real problem for me. So one of my tips, at least, is, and I know it sounds a little bit cruel, but if you've got pets or if you have a cat that likes to wake you up, put her in the kitchen at night. That's what I had to do, because she kept coming on in and waking me up, and being a bit of a nocturnal creature, I figured that my sleep was more important than her prowling around my room. So she's perfectly safe in there. So that's one of my tips. And then from a food front, at least, the later you eat, the less you eat. I find that works really quite nicely too. And again, it's that 3 o'clock wake up time. I tend to have my last fluids in and around dinner time, because then again, if that limits the number of times that I pee in the night, then that's one less reason to wake up.
Yeah, great. Thank you. And I recall, right, you attended our Mindfulness for Sleep Wellness course back in January.
I absolutely did. And so it was a fantastic course. And again, I'm not a great sleeper, and going to your course gave me some fantastic tips. So I can't recommend it enough.
And lastly, Ratna, how about yourself?
Yes, sleep is very important for me. And I think for me, before sleep, I try not to touch my phone at least. And before that as well, I will, you know, do my gratitude journaling as well. I share the 3 things that I'm grateful for, and that I am going to focus tomorrow. And so like the 3 things that I wanted to celebrate about myself. I think this practice has been really life-changing for me. It has really helped me a lot in becoming a lot more positive at life. And I think apart from that as well, I usually do like a 1-minute body scanning exercise while lying on my bed, and just all the way from pose to state and feeling grateful. And yeah, just imagining what can be possible, what's going to be exciting things tomorrow. So I think that really helps me a lot to just sleep well and wake up feeling recharged.
Thank you. Thank you. Yeah, so yes, body scan is something that's really helpful. You know, sometimes when I do the body scan for myself, before even completing it, I might actually fall asleep already. You know, if some of us here are parents, right, in the audience, I find personally for myself, when I read and follow a bedtime routine, for example, reading books to my son, it also helps me to wind down as well. And that includes, putting my phone away, right? Because phone can really be a big distraction. So if you find that your phone is always under your pillow, in your pillow, beside your pillow, and anywhere close to your pillow, if you can really put it a little bit further, so that we won't be so tempted to look at it as we begin to wind down. Yeah. So with that, I'd like to take this time to thank everyone really for this afternoon, for your time in learning a little bit more about your sleep inside out, right? So really, as I'd like to take this time to thank all of our speakers, right? For taking this very precious Sunday afternoon to share these very valuable tips with everyone here. So we have recorded this session and we'll be editing some of the segments of it and putting it up so you can refer to it again. So if there are things that you forget, you can always revisit. Please also stay tuned, right? We hope to follow up with more of such webinars to educate the public on the importance of our sleep health. So in closing, I'll just like to share one last thing, which is our sleep health screening that we have just recently launched. So it's a 20-minute session, and if you are interested, you can actually scan the QR code. Our Mindfulness for Sleep Wellness course, as Dr. Naras has strongly recommended. If you do like to improve your sleep quality and, if you face issues in terms of waking up in the middle of the night and want to learn ways to calm the mind, do give this course a go. I can check it out on our website. The QR code is there, and there is a special promo code at the bottom left-hand corner.
Thank you all again for attending. I think that awareness and knowledge are just the very first steps towards caring for our sleep health, and I really appreciate that all of you are here today to get a little bit more of that knowledge. And again, all of our expert speakers for sharing their tips and advice with us. So for World Sleep Day, there was a survey actually that was published by the company ResMed a couple of days ago. This was a very big global sleep survey. And unfortunately, the state of sleep in the world is still not really all that great. So only 40% of the respondents of that survey internationally said that they get at least 3 good nights of sleep every week on average. And many of you probably also know that sleep health in Singapore leaves a lot to be desired. So we are still among the shortest sleepers in the world, and we also report some of the worst sleep quality in the world, unfortunately. And as we've heard today, this can have both short-term consequences for our mood and for our productivity, but there's also kind of a looming danger of this being a big health burden for our society in the future. So what I want to leave you with, I guess, is to invite all of you here today who clearly care about your sleep and the sleep of your loved ones in some way to help us to be our sleep ambassadors, share what you've learned today, spread the word, and help to kind of lead the way towards making positive changes, because every voice, everyone who advocates for sleep in our community counts. So let people know about us, let people know there's hope, and there are things that they can do to help them to get better sleep. And with that, thank you all again, and enjoy the rest of your weekend.